So I had a question about a case that we had talked about before regarding a full mouth restoration. And what is this called? This is actually called an orthotic. It's not a splint. The definition of a splint is to immobilize, and that's what people wear at night when they're grinding their teeth. An orthotic aligns, if you think about orthodontics or ortho. So we're realigning the bite. So this actually is not flat like a typical splint. This has anatomy. So when the patient bites down, it feels like there's a home, and we can develop new muscle programming in order to restore this patient's bite in a totally new position. How we build these orthotics is we use jaw tracking, EMG analysis, and also TENS to relax the muscles. The idea is I want to relax the jaw and all the muscles that posture and move this bone and figure out where that bone is when it's relaxed, and then pick out a spot in between the teeth that I can record that is going to be optimal to restore this patient's bite and smile. Once we figure out where that spot is, then I communicate that with the lab, and they build an orthotic for me that snaps down over the lower teeth. It has anatomy. There's multiple purposes to the orthotic. One is we want to get rid of or minimize any symptoms that the patient's having. So by operating from a position of physiologic rest where the muscles are more comfortable, we're able to get rid of headaches and jaw pain. The other thing is we want to make sure that we're not introducing any symptoms as well. I like to have my patients in an orthotic for at least 30 days without symptoms. Then I know that I'll be able to restore this patient's mouth in this position in a way that's going to be comfortable to them for long term. The last thing that we want to do is just go in there and put some porcelain in willy-nilly, and then have a patient that has headaches and jaw pain that we could have avoided. Let me know if you guys have any other questions.